Malaria is an age-long disease that has plagued humanity for centuries and a serious threat to development in sub-Saharan Africa. It is one of the most deadly and widespread diseases in the world, killing millions of people every year with an estimated 229 million cases and 409,000 deaths worldwide in 2019, of which 93% of cases and 94% of deaths occurred in African region. Most of these cases and deaths occur in sub-Saharan Africa, where the disease disproportionately affects children under the age of 5 and pregnant women. Nigeria has the world's largest malaria burden, accounting for 27% of the world's malaria cases and 23% of malaria mortality globally. World Malaria Day is celebrated to raise awareness on the global efforts to control and ultimately eradicate malaria. In order to curb the widespread of the disease, the Nigerian government recently approved the use of R21 matrix malaria vaccine developed by scientists at Oxford University.
NAFDAC, in exercising its mandate, is stipulated by its enabling law, PAP N1 2004, to grant registration approval, and is granting registration approval for R21 malaria vaccine, recombinant and adjuvanted.
How will the introduction of vaccine further assist in bringing the numbers of people infected to the barest minimum?
Vaccination is a veritable means of preventing any disease. And if you talk about a disease as important as malaria, what we call plasmodiasis in medical parlance, if you have, we are talking about a disease of that magnitude, you know that the introduction of a vaccine is going to go a long way to help the population. That's a huge one, and it's going to go a long way to help in the control of malaria in Nigeria. The government will find ways of integrating this properly, but since it's a new vaccine, so many other policies will come up on how we go about it. But I can assure you that an effective malaria vaccine, like what we are talking about now, is going to help us in no small measure.
You know mosquito, you know how small it is. Even the parasite itself, you know how small. Its microscope is what you use microscope to see it. So you now develop a vaccine to it. It's going to be very, very difficult. It's not going to be easy. And I doubt we don't change our attitude. We won't have any effect. You know, they'll be talking about typhoid vaccine. Has it reduced the incidence of typhoid fever? No. Because the real problem is our dirty environment and our attitude. So in as much as we still continue to maintain the same lifestyle, I don't see any vaccine that is going to help curbing malaria. I don't see it.
Medical practitioners whose belief is beyond vaccination urge residents to ensure consistent cleanliness of their environment.
We know that mosquito is the major problem we have. And mosquito breed where there is swamp, water, stagnant water, bushes around the house, dirty environment. So these are the issues. When mosquitoes now get a chance to breed, then it's easy for mosquitoes to bite people. It bites people in the church, in the car, everywhere, in the homes. So to curb malaria, we have to be able to curb this multiplication of mosquitoes.
A major way of preventing malaria, very important, is environmental sanitation. Good hygiene, our kitchens, our toilets, and all the surroundings. Environmental sanitation, very important. We've also been talking about good antenatal care. Currently, the World Health Organization recommendation is that women who are pregnant should have some visits, up to 5, 6, 7, 8 per pregnancy. Within this period, they usually have what we call prophylactic anti-malaria. They get treated. For our children, the use of insecticide-treated nets, ITN, has been advocated over the years. It's very, very useful.
In a bid to curb the disease in Ondo State, the state government has distributed about 3 million insecticidal nets to households in the 18 local government areas of the state to reduce the prevalence of malaria, especially among pregnant women and children under the age of 5. The theme for World Malaria Day 2023 is time to deliver zero malaria, invest, innovate, implement, with emphasis on urgency to invest resources, innovate strategies, and implement actions towards achieving the goal of zero malaria. Joy Pius, OSRC News.